Are there signs of an asthma attack that really merit a trip to the emergency room?
Yes. But I want to preface it with, again, if you're really able to stay in good contact with your doctor, keep up with your regular visits, and identify sort of what situations your kid is having asthma problems with, you should almost never end up in the emergency room because you're being monitored and controlled on a day-to-day basis. Having said that, that if you require frequent albuterol treatments, so I would say if your child is having an asthma attack and you give them an albuterol treatment, you give him another albuterol treatment 30 minutes later, you still are not convinced that he's really doing well enough, and you give him one more and things have not changed, it's time to go to the emergency room. If you have a child or a teen, and they are having trouble speaking because as they're speaking in sentences or phrases, they're running out of breath, and this is the case even after several albuterol treatments, it's probably time to go to the emergency room.
And I hate calling it mistakes, but maybe slip-ups. Are there slip-ups that you see parents making that can land their child in the emergency room?
The biggest slip up, I would say, and it's certainly human nature, so I can't blame them, but the most common thing that I see is I will have patients come in and I will put them on some type of controller medicine or maintenance medication and to minimize how often they're having their asthma attacks. And the medicine does exactly what it's supposed to. Their asthma gets really under control. And now this child who may have been getting albuterol every other day or was having symptoms every other day, now it's only happening once every few weeks. The parents are thrilled and their knee-jerk reaction is, let's stop their medication, he doesn't need it anymore because he's doing so well. And invariably, as soon as they do that, within a few days, the child is at risk for having a pretty severe asthma attack. And they'll end up in the emergency room, or if not in the emergency room, they'll certainly get pretty sick.